What's up, y'all? It's Mushfique here, and today we're talking about the common misconceptions we have about OCD, and we're learning from an actual OCD specialist. So I'm going to take a second and let her introduce herself too.
Hi, my name is Karla Pineda. I'm an OCD and anxiety specialist, and I work with OCD and anxiety in adults. I primarily use exposure and response prevention.
Yeah. So, Carla, I wanted to ask you about OCD because there's often like so much misconception, and you go online and like you see TV. People are often talking about OCD as something as like someone that's like very particular and just like cleaning themselves and someone that's tidy. So, can you like explain to us like in common terms like what exactly is OCD?
Mhm. Yeah, that's actually a huge misconception that I see of people just liking to be clean or just liking to be tidy. And with OCD, it really isn't like that. So, OCD is mental health disorder that's characterized by obsessions, which are intrusive thoughts that feel really intrusive and really uncomfortable. It can be intrusive thoughts, it can be images, it can be intrusive urges, and people will try to do things to make those intrusive thoughts go away because they are so distressing. So they'll do things like check things or replay scenarios in their mind. There are things that they're doing to try and make those go away, and those things are called compulsions. OCD, it can be mild or it can get to the point where it just completely disrupts someone's life.
So, if I'm understanding correctly, if I just like cleaning my hands because I don't like germs, that wouldn't necessarily be OCD.
Yeah, exactly. So if you like cleaning your hands, it's probably not OCD. OCD generally, people feel extreme discomfort when they don't do something. So when they don't do a compulsion, feels not just a little uncomfortable, but it can feel extremely distressing.
Yeah. So you kind of touched on like the compulsion piece. So oftentimes when I think of OCD before I learned what it actually was, I would think it's just like, oh, you're just having these thoughts. So what exactly is this compulsion piece that you're talking about? Is it just like, oh, if I don't wash my hands, something bad will happen? Or is it just like, oh, like, is this something like people can get over? Like, how does that even work? What is this compulsion component?
Yeah, so again, the compulsions are the thing that you're doing to make the intrusive thoughts go away. So that can look like physical compulsions that you can see, that you and other people can see, like washing hands.
Yeah.
But it can also include mental compulsions that other people can't see.
Yeah.
So things that you're doing in your mind. So sometimes that can look like giving yourself reassurance. So telling yourself, oh, it's going to be okay. It's going to be okay. And other types of mental compulsions. It's not just like if I don't wash my hands, I'm going to be a little bit uncomfortable. It does tend to be more like if I don't wash my hands, something bad might
Yeah.
happen.
Yeah. So if I'm understanding correctly, it's not necessarily just like, oh, I don't like doing this. There's a severity to it where it's like, this is so distressing to the point where it's impacting my day-to-day life.
Yeah, and it can be impacting your day-to-day life because you're afraid that something bad will happen or that you'll get sick, that you'll get other people sick, but it also can just impact your life in that you feel that that feeling of the germs being on your hands will never go away.
Yeah. So you kind of like walked into my next question. Is OCD just about contamination? Is that the only thing that people worry about?
Yeah, that's an excellent question. No. So, what you commonly see in media is OCD depicted as just contamination, just hand washing, or wanting things to be a certain way or a specific, wanting there to be a specific order to things. But OCD actually, there can be themes related to harm of others, harm to self, just harm happening around you. There can be themes related to relationships or sexual orientation. Um, there could be themes even related to things like suicide. So there are all kinds of themes that OCD people with OCD become affected by. There's like an indefinite amount of themes. It really tends to hit people with the things that they care about and value most.
So if I'm understanding correctly, like I can imagine how distressing it probably is because like you're walking around and you're not wanting to hurt yourself and yet you're constantly thinking about it. That must be like horrifying to be like, why am I having these disturbing thoughts and I can't make it stop?
Yeah. Yeah, that's exactly right. So, the thought will pop up. and they'll get really scared by the thought because they don't actually want to do that. But sometimes it can get so scary, or it can become so much that people start to question their own reality.
Yeah. And I can imagine that's really hard. So what like and like it's probably really hard to like explain to other people, right? Like I'm having thoughts about hurting someone else, but I'm not going to do it. So like how can someone that's really having these thoughts like explain that to somebody or like even like get help when it's like so shaming and so scary?
Yeah, gosh, that's a great question. I would say providing some education. So it can be really scary to talk about these things with someone else, even professionals a lot of times. So I always tell people that they don't necessarily have to tell anyone and everyone, but it can be important to just make sure that they find the proper help and support. I think really a big issue is that a lot of people really don't understand, and even a lot of therapists sometimes don't understand. Sometimes therapists don't understand, psychiatrists don't understand.
Mhm.
So it can be really hard to actually tell somebody.
Yeah. So when that happens, like, what do you think are some things that can help them support it? Like, what are some things that'll be like, okay, this makes me feel less alone? And how do they find support? How does someone that has OCD or they think they have OCD and they're struggling get help?
There are support groups for this kind of thing. So, the International OCD Foundation has support groups that you can find through their website. I would say finding a mental health professional that understands OCD. It doesn't even necessarily have to be someone that is an OCD specialist, but at
Mhm.
least that understands what's happening can be really important. And providing some mild education to the people around them. So maybe their own family or friends before telling them about their own specific thoughts,
Mhm.
just so that they have some frame of reference.
Yeah, that makes sense. So now, like, we're talking about getting help and finding someone understanding. How does that work? How do you go about going like asking the right questions to a therapist even like being like, "Hey, like how do you work with OCD?" Like how like me being a client and I'm very lost and I'm trying to find the right therapist. What do I ask to make sure I know, okay, this person is going to understand me?
I think just asking, how do you work with OCD is a good first question. I always think that knowledge is power. So, becoming more informed about what the therapeutic process for OCD is supposed to look like
Mhm.
can be the most helpful. So, in general, exposure and response prevention is the gold standard for OCD. It's one of the therapies that has the most evidence behind it for OCD. And knowing about exposure and response prevention before going into a consultation with a therapist or that initial appointment can help to just feel more in the driver's seat.
Yeah.
I would say it would be important to ask about mental compulsions. A lot of therapists don't know that mental compulsions are an issue, and that can be, if a therapist isn't addressing the mental compulsions,
Yeah.
sometimes that can make things worse too.
Yeah, because they're probably might enable it probably too
Mhm.
without understanding it.
Yeah. Yeah. So asking about if they understand mental compulsions, what their how many clients with OCD do they actually work with? What does their training look like to work with OCD? A therapist can work with a lot of different things, but OCD specifically, it really requires a very specific form of treatment.
Yeah, that makes sense. And like as being as a therapist that's a generalist, oftentimes I even like refer out clients with OCD because even though I can help them with their overall like mental health, like the specific thoughts that they're having, I might not be able to because that's a whole session that we have to work on
Mhm.
too. So it makes sense. So as we're talking about a lot of these things, what do you think like some misconceptions like even mental health professionals have or like myths that mental health professionals that fall into. So if therapists are watching this, that they can like be aware of.
Mhm. Yeah, so some, misconceptions that I've seen is if clients have thoughts or if people have thoughts about, intrusive thoughts about harming themselves, that they actually want to harm themselves. A lot of times this can lead to, getting improper treatment or, being referred to a higher level of care, more therapy than you actually need. Some other misconceptions are that, they might be a harm to others or that maybe something happened in their childhood that has made them this way, and
Yeah.
that is absolutely not true.
Yeah.
Um, OCD it really is about those intrusive, distressing, thoughts and the compulsions that people do to relieve those thoughts.
Yeah.
The other thing too is actually everybody has intrusive thoughts. It's just that for people with OCD, they tend to be more sticky. It's harder to kind of let those thoughts go. So the thoughts themselves aren't an issue, but sometimes therapists and other mental health professionals don't realize that the thoughts aren't the
Yeah.
issue.
And if I'm understanding correctly, trauma doesn't cause OCD.
Right. Exactly.
Yeah.
Yeah.
So if trauma doesn't cause OCD, what does? Do we know that or do we have understanding of it yet?
Good question. We don't 100% know. There can be more. Sometimes if someone has OCD, someone in their family might also have OCD.
Is OCD something you can just like get over by yourself? Is this something because oftentimes there's this myth that, oh, you're just not trying hard enough to just get over your thoughts, or you're not doing enough. Can you just try not thinking about it? Is that something you can just try hard enough and stop thinking about it?
Yeah, that's an excellent question. Not really, because honestly, if you tell yourself to stop thinking about it, I mean, if I were to tell you to not think about a pink elephant, the first thought that comes up is a pink elephant, like an image of a pink elephant.
Hmm.
And so to tell somebody to to just stop thinking about it, honestly, trying to stop thinking about it can be a compulsion and actually can just make that worse, and most people don't know that, and so it's really hard to just, move forward from OCD or, be uh, kind of recover from OCD on your own. It's just really hard to do it on your
Yeah.
own.
So what I'm hearing is if your loved one has OCD, telling them just get over it is not going to be helpful.
Yeah, it's
Yeah.
not gonna help. If anything, they might just get frustrated and, not tell you when they are struggling.
Yeah. So what is helpful? What can, let's just say a parent is seeing their kid struggle with OCD and parent is really perplexed and they don't really know what to do. What could a parent do?
Yeah, doing finding any kinds of resources, honestly, is number one. Psychoeducation, just learning more about OCD can actually help to reduce some of the symptoms. So for parents, going onto websites like the International OCD Foundation, learning more about OCD through their website. I think they have a parent, they have a traditional OCD website, and then they have a website that's more for kids and parents. So learning more about it there, and there's a lot of resources online and even books and workbooks that they can use to learn more. Um, and then ultimately, if OCD really starts to take over a kiddo's life, then looking for some kind of treatment like exposure and response prevention, or
Yeah.
even there's another treatment called SPACE that's specifically for parents if kiddos don't want to be involved.
Yeah.
Trying to find the right treatment.
Yeah. So what I'm hearing is like waiting is not probably more beneficial and it's not something that's just gonna go away because we want to pretend like it's not there.
Right, right. It's not something that's going to go away. If anything, waiting sometimes will make it worse.
Yeah. And something I've noticed in like the practice I do is like I've noticed kids will come in or teenagers will come in and I'm hearing they started having these compulsions like 10 years old. And now it's gotten to the point where it's like it's so unmanageable too. So it's really nice to know like this isn't just like a one-off case. Like every single time you see when we don't treat it just like a physical illness, it does get worse.
Yeah, absolutely. Usually there can be sometimes people who have OCD, and who where it gets bad when they're older, they can look back to see when they were younger when there were bouts of OCD that came up, and sometimes they would disappear on their own for a while. But once it gets to the point where it's really distressing, even as kids, where it's really distressing and it's not going away, then it's really time to address
Yeah.
it.
And it makes sense because it's just like any other mental health struggle that you have.
Mhm,
Like you have to be, if not preventative, like proactively working through it. So as we are talking about a lot of things, so what's like one thing you wish people understood about OCD, and what, like if you had to give a message to impart to everyone watching this video about OCD, what would it be?
mhm. I would say that OCD can be about anything. It's not just about cleaning or organizing or lining things up perfectly. It can literally be about anything as long as the thought feels intrusive and it feels uncomfortable and distressing, and there's something that you're doing to make the thought go away. Um, anything that fits that can be OCD.
Mhm. And that makes perfect sense. It's something that's like, it's not just like, "Oh, I'm so quirky because I like lining up all my toys." It's, if I don't line this up, I'm going to constantly think about it, and it's affecting my day-to-day functioning itself.
Yeah.
So, other than that, if someone's watching this and they need to get help with OCD, and if you feel like, okay, if they heard this, this might be helpful, what would it be?
It's not your fault. You're not a bad person for having these thoughts. Intrusive thoughts are just thoughts, just like any other thoughts, but they can feel more scary to people with OCD. But it doesn't, those thoughts don't say anything about you as a person. They're just intrusive thoughts that you're having, and you can get help.
Yeah. So basically, this understanding of like, you are not your thoughts, you're struggling with something that is related to your mental health and well being, and there is help for it to get better,
Mhm.
if I'm understanding that correctly.
Yeah, that's exactly right.
Yeah. And like, that's some of all the questions I had. If you want to like drop any information about yourself and link anything, please let us know. And I really appreciate you helping us with all of this.
Yeah, of course.
Yeah.
Thank you. Thank you for having me. You can find me specifically on Instagram at Karla Pineda OCD. I also have a mental health practice where a lot of us focus on working with OCD. Our practice is called Layers Counseling Specialists. So those are the two places that you can find us.
Yeah. And if you like this video, please like and subscribe. And I hope you have a great day.